Welcome to the CIDCI online Salon series. I'm Margie O'Driscoll, and on behalf of the CIDCI Board of Directors, I'd like to welcome you here today. The Center for Innovation in the Design and Construction Industry's mission is to accelerate innovation, disruption, and change to improve the built environment for everyone. We create networks that share knowledge, experience, and ideas through productive dialogue. We're a not-for-profit organization that relies on financial support to provide these programs, and many thanks to our sponsors who make all of this possible. CIDCI is proud to announce the start of our Innovation Lab next month. It's being led by UC Berkeley's Sarah Beckman and Rachel Zombach, and it's an online program that uses a self-paced format to create a community of practice within the AEC community. This 6-module program will teach participants the mindsets and skill sets associated with the innovation process. The content for the modules will be delivered asynchronously via Google Classroom and will include videos, readings, and discussion questions. Participants can access the material at any time during the 2021 session. Details are available on the CIDCI website. CIDCI is also starting to plan our fall forum entitled Inspiring Innovation in a Reemerging World, which will be from October 4 to 8 at 8 a.m. Pacific. Over 5 days, we'll spend our mornings or evenings, depending on your time zone, exploring a wide range of issues, including how building owners view our return to work post-pandemic, what failure can teach us about resiliency, and examine some of the startups changing the world. All of these events will be online. If you see something you want to share with a client or friend, feel free to direct them to the CIDCI website to hear recordings of this event and all these other events. Okay, here's a bit of information about how today's session is going to work. We're recording the presentation and we'll place it on our website. If you have questions or comments during the presentation, please use the chat box. We hope this will be a very interactive session. Today's session will run for 60 minutes. CIDCI is delighted to co-sponsor today's event with the Association of Medical Facilities Professionals. Today, we will explore A Tale of Two Systems, a discussion of the past year and how we can move forward equitably. This conversation comes in a week where we've celebrated Pride Month, the new national holiday of Juneteenth, and the release of 2 groundbreaking studies, the first of which examines a tree equity score from the American Forest Association, as well as the roots of structural racism created by the Othering and Belonging Institute at UC Berkeley. These studies provide data to support the awakening of this country to systemic racism and a path toward understanding what the architecture, design, construction, and technology communities can do to respond. I'd like to welcome you all here and now ask John Inman to say a few words.
Yes, thank you. Good morning, and thank you everyone for joining. My name is John Inman, and I am the president of the Association of Medical Facility Professionals here for the Northern California chapter. And it is our mission really to advance and share knowledge for the healthcare built environment. So please, if you're interested in learning more about us, visit our website. We really hope you enjoy today's discussion. But before we start, I do want to thank the ICDC for partnering and our AMFP leaders for producing the event. We are really pleased to present this distinguished group and such a timely topic. Now on to the introductions. Thank you.
Hi, my name is Heather Chang. I'm a VP with Smith Group and co-chair for the Programs Committee for the AMP. And I'm just so excited to be part of bringing this really esteemed panel and dedicated individuals to this discussion. This is a group of not only really expertise professionals, but really passionate humans. And I hope that they believe that they're going to bring a lot to this discussion and share their experiences with us. We are a group that's invested and dedicated to really designing and building an environment for all. And so that's why I really hope that their experiences really help accelerate our understanding and activism around this. So I want to start off with Juliet Rogers. She's the president of Blue Cottage of CannonDesign. She's been a colleague working with me on several different projects, but she's always been a longstanding champion for healthcare for all. And that's why her as a moderator in this position is an excellent, where she can bring her expertise and strategic and overall industry-wide understanding. The next I'd like to highlight is Dr. Thelma Hurd. She is essentially leading the establishment of our newest UC campus and expanding medical education in the San Joaquin Valley. She also has dedicated not only her life clinically to advancing oncology and treatment oncology, but really advancing research and data around health disparity. And so appreciate the voice that she brings here. Jamie Phillips is, again, another colleague that we've been working with, works for and is a COO for Benioff Children's Hospitals, both in Oakland and Mission Bay and across the entire system. She brings a long legacy of really championing pediatric health and understanding what it means on the academic medical center front. And she's going to bring a great voice in terms of really understanding at a personal level what it means to the families. And the last but not least is Rosa Chang. She's my colleague and compadre up at Smith Group. She's been an active champion, not only within our firm and in the work for equity, but also across the board, across our industry as architects and architect professionals. So with that, I hand it over to Juliet.
So much, Heather. It's so exciting to be on a panel of people that I either have been dying to meet or have recently met and I want to be best friends with. So I'm so excited to be with all of you today, and certainly humbled by just the opportunity to do this on a topic that is very important to me. I think it's very important to obviously to everyone here. And as you said, it's timely. And when I was reflecting on the timeliness of the panel, I mean, what struck me is that for many of us, definitely for the group on this call, but also for many of us in the public health, the healthcare, the education sector, these are not new connections to us. I think we just all of a sudden are having a window to have a voice and to bring more people into this conversation. And when I thought, what kind of conversation do we want to have, do we need to have? And obviously this is one of many that needs to happen. This group wants to do either a 3-day or a 3-month workshop on this topic. We haven't decided. And we hope many of you will want to join us in that. But when I was reflecting on 2020 and just how differently it impacted different people, even different people from the same family had very different experiences. What I think that one of the common threads that I saw threaded throughout the entire experience was just the fear related to uncertainty, and the uncertainty around how an individual would be impacted, how a family, how a community, how a system, how our country, and then like how the globe. And what struck me about all of that is that I think what the pandemic exposed, like I said, it's not that many experts didn't know. A lot of people knew that this was coming, and that if there was a pandemic, that this is what would happen. And that was the fear of many people in the public health arena and in any subject that studies this. But I think what it exposed is just the fragility of systems that I don't think we really appreciated were as fragile as they are. And when we turn work on its head, and all of a sudden the essential workers that we depend on, everyone recognizes we're not paying enough and we're not treating them well and we're exposing them to the biggest danger. And all of a sudden we understand that maybe this system of distributing food and family meals through schools only works when our schools are working. I mean, I think there were just the interconnectedness of things that we thought were good ideas. And then you realize that when you put a system under stress, some of your best ideas just completely break down. And I think among all the things that happened throughout this pandemic, it has opened a chance to have a different kind of conversation about health equity, social equity, and just equity in general in this country. And some of you may have seen that ABC News and some other news agencies carried a story yesterday about a study done on what the pandemic has done to life expectancy in this country. And life expectancy is a tricky number, and we could debate like what it means and everything, but the point here is that we have worked for decades to close the gap, especially for Black men, between Black men and white men in this country. And the pandemic effectively wiped out 2 decades of work on closing that gap. And we may get some of that back because, like I said, life expectancy is a complicated metric. But the reality is it just shines the light on just how differently this pandemic affected different communities. And whereas I think everybody knows that on a surface level, sometimes it's really hard to see how all these things are connected. So what we're going to try to do today is, through different stories and through personal experiences and anything that the panel wants to bring to bear on the conversation, we're going to start to talk about some of the interconnectedness of all of these things, and maybe some places where they don't connect and they should. And Rosa Chang is going to get us started.
Thanks, Juliet. Okay, I'm going to share my screen. And the way we're going to frame this conversation and the interconnectedness of healthcare outcomes, I presented this, the full keynote presentation at the Living Futures conference earlier this year. I'm only going to share a part of that presentation with you to kind of spark the conversation that I think we need to be having. And as Juliet mentioned, 2020 really highlighted a rude awakening, if you will. I call it another inconvenient truth, is the intersection of not only social and environmental racism, but the health impacts and the health implications of those intersections. And what I started out by analyzing in the data, starting with the violence, anti-Black violence over a course of time, is that which culminated in last year's murder of George Floyd as a kind of inflection point, if you will, on this particular issue in America. But racism goes beyond the internal and the interpersonal beliefs and the outward expression of hate and violence. There was an article that was written by Hop Hopkins of the Sierra Club called Racism is Killing the Planet, in which he daylights the history of extraction and exploitation of land in the United States, as well as not only the enslavement, but the disproportionate amount of those who are put into labor and segregated from society at large. And the long-term impacts of those outcomes, he postulated as this thesis, that we have climate crisis. We can't have climate crisis without the concept of racism. And he makes the connections in this particular order. With climate crisis, there is a resultant of centuries of a mindset of extraction, which is represented in the sacrificial zones that we witness today in our cities and across the country. Pollution, not only in the air, but in the water. And we have that condition also because of our concept of disposable people, that certain people are not worthy of getting access to healthy environments and resources. And we have that because of racism, the concept or belief that certain races are superior to other races and therefore should be treated differently. His quote was, "We'll never stop climate change without ending white supremacy and racism." And so I started down a rabbit hole of studying this and daylighting the intersections of the issues, not only of social impact, environmental impact, but the disproportionate vulnerabilities of health outcomes because of it. We start with looking at broad examples of the Keystone Pipeline, as well as local examples in the Bay Area of Hunters Point in terms of the toxins created and the communities that are deemed fit to live near these zones, usually marginalized communities and those disinherited from access because of systems and policies such as redlining. When we look at data points over time, we see that there are a disproportionate amount of Black and Hispanic and people of color exposed to PM 2.5 in our environment just by daily occurrences, which could range from particulates from road dust all the way to agriculture and gas emissions from vehicles. And if we look at also heat island impact across the US as well, there's a disproportionate amount, again, of people of color who experience the negative impacts from the heat impact especially in urban zones. We can look at recent events in the last year as also another point of that intersection of racial impacts on and environmental impacts, where the forest fires that we've experienced across the country, but in particularly most on the Pacific Northwest and the West Coast in California, have created again, more vulnerability in the air that we breathe for Black, Hispanic, and Native Americans, about 50% greater vulnerability. When we think of COVID, again, as another overlay of vulnerability for health impact, we know the information of that a disproportionate amount of people of color are not only getting COVID, but also experiencing a severe impacts of health and potential deaths because of the disease as well. If we dig a little bit deeper, we can see not only the social determinants, but also the environmental determinants of those health impacts, whether it's the occupation that a particular a demographic is prone to be in, which is the essential workers that during COVID were not able to shelter in place, but had to go to work every day, the cooks, the frontline workers, hospitals, healthcare, nurses, et cetera. Most of which, again, people of color were impacted by that compounded exposure. And finally, the smoking gun of this intersectional research is when you superimpose maps of redlining with current data about areas that are sacrificial zones, i.e. areas that are deemed disposable and pollutant prone by our country and our industries. And then you look at the areas where those people that are generally marginalized live in those sacrificial zones, the outcome of which is the compounding of the other exposures that I mentioned and COVID impacted those getting the disease and dying from it, in particular in those sacrificial zone areas. I know this is a lot of information to digest, and we can make this abbreviated version of the slide deck available to all of you to take a deeper dive into, but I thought it was a good starting point for our conversation today.
Yeah, thank you, Rosa. I mean, it's definitely a sobering and eye-opening. Since you showed it the other day, I think I have talked to no fewer than 10 people about it in about a 48-hour period, and wanted to do a deeper dive myself, in part because this idea of sacrificial zones and disposable people, it's so hard to hear it that way. And when I was kind of taking the journey through your slides and through what you presented, I couldn't help but think about the cumulative impact of all of these different forces on disadvantaged or at-risk people, or just people who live in those communities, because there may be people that live there by choice and are still impacted by all of these factors. And when I was thinking about how many of us really are committed to equity and want to do this kind of work and take meaningful action, given the weight of of what we hear and what we see, and the weight of structural and systemic racism in general, I think it tends to be paralyzing and overwhelming for a lot of people. And I think people just wonder, like, what could I possibly do to fight an entire system? And I was hoping that each panelist could just talk about how the work that you do connects in any way, small daily acts or large projects. But I would love to hear you reflect on the connection that your work has to communities, institutions, individuals, or just this greater challenge. Jamie, can we start with you?
Sure, thank you. And I appreciate the opportunity to be on the panel here. You know, within my role as a chief operating officer for 2 children's hospitals, it's sobering just to think about just the amount of the ecosystems of oppression that has existed in our country. And, you know, COVID probably brought it more to light, but as we all know, it's been here for 400 plus years. Within my role, when I look at equity, I really try to look at it in various different lenses and how to keep it ingrained in everything we're doing every day. And that goes to, you know, looking at, you know, around quality safety and looking at data and differentiating it by race and making sure people have language access. How are their experiences when they come to our organization? It's quite different when we look at it by race, and even when we look at clinical outcomes. The other piece is as what is ingrained in race and medicine. Some people believe that doesn't exist, but it does exist every day for people of color to come in and obtain health care and how they're treated differently and how that is impacted by policy. In regards to the environment, it really gets back to, how are we developing our communities? How are we creating public safety within our communities? And how that is resonated in our buildings of when we deliver care. And then lastly, there's been a ton of energy within our organization just around the social and structural determinants of health. And how do we engage with other community agencies, schools, to understand what they're struggling with before they get into the walls of our hospital. And that might be, how do we create generational wealth? To get people the education that they need? How do we screen people when they come see us about food security? And what are we doing to address it with the resources that are available? And then also, it's just the impact of trauma to one's health. And how are we screening for that? And how are we addressing their mental health needs? So those are just a couple. I'm sure we'll have further discussion. But from my perspective, that's what we've been trying to hone in on.
Yeah, thank you, Jamie. I think you teed up a lot of directions that Dr. Hurd can certainly build on. Thelma, would you like to go next? I think you're on mute.
Okay. So I share many of Dr. Phillips's reflections. In terms of what we were facing, we look at it, I'm looking at this through a slightly different lens. The fact that we are in the Central Valley, in a rural area of the Central Valley, not a micro-urban area. And so we had, and we continue to have, very distinct challenges. Before talking about this, I think we also need to think about the fact that contextually, we are at the halftime of the COVID pandemic. We are not at the end game. We are not in the end zone, and this is not an end game. And so I think what I can say that in terms of where we are from a 200,000 foot perspective, we're learning to live with extreme uncertainty. And that's what we need to really frame this as. Also, that the challenges that COVID presented certainly highlighted the fact that we have a public health system that really fundamentally imploded in terms of the burden, because we haven't had anybody who lived through the 1918 pandemic is no longer with us. We had no longitudinal memory, and pandemics and high mortality health events are something that until COVID came to our country was something that happened in other countries. I also think that we need to better understand, I think we keep referring to underserved populations, and one of the realities that has began to, one of the realities we need to face is that the definition of underserved population has changed dramatically over the last 15 years. And an example of this, if just in terms of what's happened economically, many components of the middle class are now in the quote underserved population. And so we need to stop thinking about underserved as an economic definition of people who are chronically poor, and understand that a significant portion of the middle class, what used to be the middle class 25 years ago, are now the quote chronically or variably, I won't even say poor, variably resource population that we very casually refer to as underserved. And if we're really going to change things in terms of health, in terms of structure, in terms of economics, in terms of equity, and in terms of access, we need to stop, we need to really think carefully about what we're defining as poor, underserved, and whether we should really even be thinking about that, because it really brings an historical, it separates people into an historical class that rather than a class that has really evolved over in the recent, let's say within the recent 15 to 20 years. So That notwithstanding, moving to the issues of rural health, in the rural communities, we really had a very different situation that we're facing. Unlike our urban counterparts, we don't have redundancy in healthcare systems. We have a different type of resilience than you see in urban areas. Rural areas, communities are far tighter knit. They understand the importance of mutual interdependency, especially in agricultural communities, which is where I am now. And so the definition of resiliency, I think we have to also think about how we define resiliency in a rural setting. In terms of some of the practical problems that we dealt with, certainly because of, certainly in terms of risk factors for adverse outcomes with COVID that really built upon living conditions, upon the built environment, and built upon chronic conditions such as asthma, for example, which is our number one, which is one of our top two problems here in the Central Valley, exacerbated these problems. We also have to understand that because of the variable resources that people had that they could actually retrieve to respond to COVID, it really made bringing together an entire community really that were intrinsic and challenges. For example, people who may be working here, once work actually started to return, but who may be working here with variable documentation status as a function of the agricultural community. How do you reach people like that when people are required in order to get a vaccine that up to, in certain populations, up to 20 to 30%, or to make an appointment may be required to give proof of health insurance, government ID, or their social security numbers to make an appointment for a service that is supposed to be blind to that. And then when they get to the appointment, they're then required to produce that. So these are things within a system that we have to think about addressing. In terms of even simple things like distribution of vaccines, I work in a county that has 275,000 residents. And within that, when it came to even distribution of COVID vaccines, we were getting 800 doses, 1,200 doses, maybe a couple thousand if we were lucky. And with that, part of it was the actual system of apportionment, which was based upon the number of healthcare providers in your region. Rural areas have fewer healthcare providers. And therefore, we have to think about even the formulae that we use for improving equity and access to treatments. And this isn't something that's just COVID, it's just COVID makes it, it provides us with an example. It also brought out the lack of education at multiple levels within our community regarding health and regarding response to health. We have become such a technocratic healthcare system that we don't understand that health and prevention and primary treatment does not begin in a tertiary referral center, and it doesn't begin in an academic health center. It doesn't even begin in a clinic. It begins at the kitchen table and in the neighborhood. And there are lessons that we can learn from this that we really need to take as we move forward into the future and really think about communities as we build health structures, be they functional organizations or physical buildings and structures, and take all of these considerations into the design and implementation process. So with that, I will pass it on to my next colleague, who I think may be Rosa, if I'm not mistaken.
Yeah, I'm gonna just interject for 1 second, because we're gonna tee up what's gonna come after Rosa, because both of you raised some points about the longitudinal lessons that we could learn from this, and we'll go back to that. But I also think what's striking, there's a striking commonality between, each of you talked about very different things, yet you both brought up data. And we hadn't talked about data and the role that data plays in either masking a problem or exposing a problem. And I think that was a really interesting point from both of you in different ways. So Dr. Hurd, you used it in terms of vaccine apportionment and what's counted and how do we use those formulas. And then Jamie, you talked about it just in terms of how we present data on safety, on access, on clinical metrics. And I think on our list of things we could do a whole day workshop on, maybe data is one of them. Rosa, with that, please share your experience.
Absolutely. So many good prompts and topics that Jamie and Thelma covered. And I think that building on top of that, education that Dr. Hurd mentioned is very important to me. I'm the studio leader for higher education, and I think representation matters in starting to shift the disproportionate access to meaningful and effective healthcare. And so in our efforts, we're actually trying to support student persistence. So in light of the demographics that we know, lack of representation in not only the STEM fields, but medicine and architecture and design fields as well. We're really passionate about educational facilities that create a strong sense of belonging, mentorship, access to resources, and a lot of students that do come from these underserved populations are likely first-gen low-income demographics, and they need a lot of support. And we believe that's also in the physical space, that space equity does enhance not only learning and educational opportunities, but that persistence to degree attainment, and also a holistic ecosystem of personal development that includes mental health management, physical health management, so that they can be successful adults and contributors to solving these greater challenges that we have. Zooming out on the macro level, I do believe in kind of connecting the historically siloed and disconnected practices of health, the environment, and social impact, and the injustices, righting the injustices. And I think I'm thinking about what Hop Hopkins said about generally extraction and exploitation, and that we are living in that kind of resultant of those mindsets and the disposal of people. And in order to kind of reverse that or reconcile that, we have to not only acknowledge those histories. I know there's been a lot of critical debate about critical race theory and even just acknowledging the past and those histories, but also creating a new mindset and a culture shift, I think, to regenerative practices, regenerative health, and a culture of care. And I say that in a broader sense of care, that if we care for the people around us, if we really care for the environment and where we live, and think of systems in ways that not are just resilient or surviving the disasters that are a culmination of the neglect, but looking at systems of nature, biophilic design, biophilic solutions, there's a lot in nature that we can learn from that can help us get to those solutions. And we could do a conference on that altogether.
I think one of the things that you just brought up, Rosa, that is threaded through Jamie and Thelma's comments as well, and I think we could use it as a jumping off point for the next part of the conversation, is how do we, in the work that we do, either collectively or individually, actually convince or demonstrate that we care? So the caring conversation, I think, is an interesting one, and one that sometimes, even as consultants, designers, builders, we think we know. We think we know how to show someone that we care, or we think we know how to respond to community need. But I think we could take that a step deeper and really talk about how do we send a message that you are not disposable, you matter to us, and in our work, how do we send that message? And Rosa, you can start with that if you'd like, with the built
Sure.
environment.
I'll give a brief catalyst and then I'll popcorn it over for a rumination. But I think it starts with a few key elements: vulnerability in our own selves, and in being authentic, and creating that sense of belonging. Beyond inclusion, I know we use or overuse the word inclusion these days to express that want to create a culture of care, but it's not enough, because inclusion to me is just tolerance in a system that's already established. If we really want to disrupt a system that has oppressed and denied access. We need to go beyond inclusion into radical welcome. And radical welcome is a concept of come as you are, as your whole self, let your freak flag fly in a way. And I'll pass it over to my other panelists for rumination and discussion.
Yeah, I can try to take that on. I, definitely agree with Rosa. The whole sense of belonging is essential. And to me, belonging comes with trust and the ability to have that vulnerability to speak up. And to tell you the truth, over the years, being a person of color is very difficult in corporate America. Recently, I don't know if it comes with more being a seasoned individual, I've been more outspoken, and I feel that's my obligation at this point to help the next generation coming through, because we all know there's very few people of color in medicine. There's very few people of color in healthcare administration. And so if anything is, how do we reflect the people that we are serving? And we don't. And it's really about deep down, I think both panelists have mentioned, is the educational system is the root of where we need to start and how to build the future of where we want to be. And so when we look back, I mean, we really are digging in data at UCSF and said, we're not reflective of our frontline people. Our frontline people were more diverse than people in leadership. And so we're taking steps that help make change there. So if anything, the root piece to me, particularly being a person that lives it and breathes it every day, is the trust and the vulnerability that I can speak up and say something is not right, and what can an organization do, or what can any community wants to strive to achieve.
I agree with Dr. Phillips completely, and share some of the experiences she's had over the decades. I think that in terms of radically welcoming, I agree. I like the concept, and it needs in it, and I like that approach to it. But I think an equally important component, it's one thing to radically welcome someone, and welcome, not even someone, but welcome diverse groups together. It's another thing to radically welcome them as equal partners. And what we have to really move away from is believing that offering a seat at the table is just fine, but you never have to engage the person actively as a full and equal partner with an equal share of power in the conversation. Because if you are just inviting a person to the table, don't waste our time. If you want us to contribute, then we can talk about this. And this is something that is not just applicable to the corporate world, to the academic world, but to the community. Too often, we invite community as a second thought, rather than bringing them to the table, or not even bringing them to the table, going to their table and asking them if what we have to offer is something they feel they need. Because we make the assumption, because of our pyramidal way of structural thinking, that we know it all. And what we need to do is, at a very fundamental and systemic level, invert that pyramid. Because at the end of the day, like when you talk about systems, when you talk about business drivers, the corporation doesn't drive the income, the customers do. And corporations are very careful about meeting the needs of their customers. And this is not something, I'm not saying, I mean, there are other issues, so I'm not negating those, but we need to really think about what we're doing and how we're really structuring our approaches to communities, because they know far more than we will ever know about their community. When it comes to thinking about building, about design, what communities need, this is dated information, exceedingly dated, but about 30 years ago, then about 30, 35 years ago, The city of Columbus, Ohio decided to increase their library. They were working to increase library resources to their students and communities. And what they did was, in one particular community, they brought the community to the table and said, this is what we'd like to do. Do you think you need it? Community felt that they needed it. What does it need to look like? How do we need to approach this? Who are the people, the architects and the builders that we need to bring to the table that can reflect and adequately meet the needs of your community? And this is something you don't, I understand Columbus, Ohio is not unique. I understand this, but is this something that perhaps often gets lost when we're thinking about it in other areas and other situations? So with that, I would pass it on to, I guess, back to Juliet. Or
yes. Well, Thelma, I think one of the things that you just said, that if we were to take it from a fairly acceptable concept, like involving community, but elevate it to something of meaningful engagement and involvement and actually listening, I would take it a step further to one of the extremes that Rosa mentioned. One of the things I think we could do to show people they matter is actually pay them for that seat at the table.
Yes.
I mean, as a consultant, I'm well aware of how much we get paid to have ideas. And in fact, I think that it's when we're involved and we have a chance to do that, and a client that can afford or agree with that, I mean, I really think it's important that when we bring people to the table and we mine their brains for information, insight, things that we could never get on our own, we should pay them. And if you think about it, that's probably the way we should be thinking about it. We would never go to an executive and expect them to sit down with us for free and help direct our project. So I think that part of walking the walk on being committed to equity is when we do that, and when we have a chance to bring somebody else to the table who's going to have unique perspectives that we really need, we should pay for those. And I know not everyone can do that. And a lot of the hospitals that I work with are safety nets, and that would be a challenge, because every single dollar on that project, they want to go into future care. But maybe there's some other way we could get to that, or maybe as design partners or consulting partners, maybe we do that, because ultimately it comes out of our fee, right? I mean, you're paying us to do that. And as clients, you probably could, I mean, this may be very unpopular for all my colleagues on the phone, but as clients, you could probably say that to me. I need you to do a focus group and I expect you to pay them. So there are little ways that we could certainly show people that not only do they matter, but we see their value, and we are willing to acknowledge it with the same way that somebody acknowledges my value. So
I'm going to riff on that and pose another idea, which is exchange of services, right? While paying somebody would be great, if you scale it up into all the people that we're trying to get answers or ideas from, one can be overwhelmed and say, oh, that's not possible with the budgets. But what about exchange of services or access to resources once the facility is built, or educational exchange? As we've tried to do that in our community college and higher ed outreach with students. Is there a credit exchange for course credits, right? Is there some kind of recognition as a TA, or et cetera, or investigative research avenues where there is credit given? And so let's expand that to services or reciprocation of things that those people that come to the table need.
Yeah,
right?
That's great. That's
Well, I think you can even, for example, we're working on a project for Oakland, and I think the other piece is, how do you, particularly for us as a healthcare system, we employ a lot of folks, and we're like the 4th largest employer in Oakland, at the Children's Hospital there, is how do you create that economic, social development that you have? Because we have people from various different sectors of how they can come into healthcare. And, even to the point, how are you having that career development enhancement that you can provide in the community that can build up the community as in totality? So I think, thinking of it, right, typically in healthcare, we say, okay, we're working in our walls and maybe a little bit out, beyond that, but not really saying, if we build a campus, what are we also building to create the economic development for that community? I think that needs to go hand in hand as we do this.
Yeah, I love it. I know that project.
I would also add that I worked with the CTSA Clinical and Translational Science Award Consortia in terms of the community engagement court at a national level for about 7 or 8 years, and now I'm a member of another group that's a PACER, that's an offshoot of that. And I think we have to be careful before we say there's never enough money to pay the community, and that you have to think about goods and services, because what the CTSA initiative showed us at a national level is that when your institutional funding depends on paying the community, you find the dollars. And so with that, I also would say that so that's one aspect. And I also would say that we should treat our community, when we think about community remuneration, we should treat them with the same respect that we treat our board of directors and our donors. The third thing I would say is that in times of economic constraint, because I am not Pollyannish, but in the times of economic constraint, rather than looking at only a goods or services or only a payment, look at a hybrid model of both and really explore those. And I don't know, you may have more experience with this. I haven't heard of a hybrid type of model used frequently employed, but certainly if anyone's aware of it, would welcome comments about it.
That's great. Thelma, we have a question from the participants that I'm going to direct at you, but Jamie, with all of your experience with academic medical centers and trainees, and Rosa, certainly in the work that you do in the education sector, I think any of you might have comments, but I'm going to start with you, Thelma. And the question is, how do we empower medical education facilities to be a vehicle for change in those kitchen table kind of discussions?
I think there's at least two or three paths. The first three that come to mind is building a strong relationship of institutional trust within the community. And I think in doing this, this is not a 5-year cycle. This is not a 3-year cycle. It is a process that is a step-by-step process in which institutions have to make a commitment, both in time and resources, to make that happen. It will not happen organically. It will not happen magically or instantaneously. It takes time. I think the next aspect is really engaging community in the process of the actual operations of the institution. Not just a focus group when you have a problem, not just community outreach when you're worried about a situation, but bringing the community to the table at all times throughout the cycle of an organization. Who do your board of directors, what does your board of directors look like? What do your community advisory boards look like? Are you only looking at the standard key stakeholders, or are you looking at all stakeholders within a community, because power differentials vary and are not necessarily related to the titles that people have? Are you engaging? What does your leadership look like? Does your leadership reflect the community? Does your community, do your employees at the above the staff and facilities level reflect the face of your community, something that Jamie spoke to earlier? Finally, but also in terms of education, are you educating your community? I mean, just like we in academia don't know everything, the community doesn't know anything, but they have a tremendous capacity and a desire and a hunger to learn about what we're doing. And we need to do it transparently. And just like in any endeavor in any business, it's that daily, that weekly, that monthly interaction at multiple levels within the organization that serve to bring the community and the institution together, while you're also bringing together the community and the individuals and the practitioners and administration within the institution, bringing them together. It is a multi-tiered, complex process that requires time, but it pays for itself almost infinitely if you take the time to put it in place at the beginning.
I don't know if I have much more to add. The only piece is I feel with COVID, the ease has become easier with technology to gain different perspectives. Before, it was, sometimes that difficulty of bringing people around the table, but with, the amount of technology we have at our discretion, there really shouldn't be any excuse of how to make that happen. And particularly in the medical education field, I was talking to one of our docs, 80% of his visits now are televisits. And so there's this transformation of how care is going to be delivered in that channel. And, it's how are we going to still be effective in being able to have that dialogue of what is happening in the home that impacts healthcare.
That's great. So in our few minutes left, I was thinking about, and I didn't telegraph this to you guys, so hopefully it'll still be okay. But I was thinking about so many topics that you covered that are really big and broad. And Jamie, the generational wealth comment stands out to me because there's been so much conversation about it, and I think it's such an important part of the conversation, even to just help people understand the movement in favor of reparations and these really big topics, right? I think that sometimes when we're at work, we feel limited by what others see as our scope of work and our scope of influence, our scope of reference. And I'm just wondering if, and assuming, Rosa, that you would think about design, and Dr. Hurd, that you would think about medical education or care, and Jamie, you could think about this from pediatrics or from just really being truly a community leader, which is how I see Benioff and the work that you do. If we were to give you a microphone to just ask people to think about one thing in a different way that you think would really impact equity, what do you think you would start with? I mean, because I know it could go on a really long time and you could have 30 things, but what do you think you would start with? If you could just make people understand, one way that what we do or what you do connects to equity and something that they might not see themselves. What do you think, where would you start? Rosa, I'm going to tee it to you first.
Okay, sure. If it was the one thing, I'll pose it as empathy and related to that intercultural intelligence, which is expanding our knowledge of the lived experiences of the people that we want to engage, right? And that we want to see be able to be co-creators and ultimately co-leaders in our society. We got to start with the empathy, and empathy starts with understanding. So we don't know the lived experiences of the people that we're trying to serve, we're losing the battle. And so I ask everyone to develop relationships, authentic, real relationships, and trust and co-respect. Start that engagement process. If you don't have any friends, look around you. Who do you socialize with? If you don't have friends that represent the variety and the diversity of lived experiences in our community, start there.
So Rosa, I'm going to just ask you one question on that, because we might not get back around to you.
Sure.
What table do you want to be invited to? Flipping that whole question around, who do you want the chance to give the chance to know you and how you feel?
Oh, wow. I'm an open book. I want that radical welcome table. I want anybody who feels that they want to be part of the conversation. It's inspired by my grandfather. He actually used to have this exciting idea of bring, whatever food you can, like a potluck. I think food helps encourage people to share their culture as well. And it's a common thing that we all do, right? And we enjoy food, and food has cultural significance. But everybody come to the table with something that is your favorite thing, and let's all explore each other's favorite things together. So
we're all invited to
welcoming
Rosa's
table.
for dinner. Take note.
Yes, please.
I take that as an invitation. Thelma, what would you use your microphone for, or your megaphone for?
Stop looking at the glass as half empty and start looking at it as half full and work from there.
Do you do that with your medical students? Do you help
Yes,
them see that?
that's my whole approach to the work I'm doing in the Valley, was to look at the strengths and the endogenous strengths and capital, both human capital within the Valley, and start and leverage that and build from there.
That's great
And I learned
advice.
that from my international experiences.
Yeah, I think that's been hard in 2020 for a lot of people. I mean, you have people who can stay positive, and then I think we have to pick up a lot of people, and a lot of people have certainly picked me up, and I'm usually a fairly positive person, but I think 2020 tested our ability to see the half full. Jamie.
Yeah, from my end, I would say just constant lens of the oppressions that are happening in our society. So as decisions are being made, pause, reflect, and are we making the impact that we want? And sometimes we don't just take that moment to do that. So that would be my one thing as we make decisions, as we build new buildings, whatever it might be in our lives, is to just pause and reflect. Are we addressing oppression that's happening in our country?
That's wonderful advice. I see Margie's coming on to close us down, I think.
I'd like to give everyone just a moment. Juliet, do you have anything you'd like to give us in terms of trying to sum up this wide-ranging and amazing conversation?
I would. For me, I spent a lot of time, especially over the last 4 or 5 days, just thinking about all the directions this conversation could take. And I think what's interesting about it is that it went even a different direction than I had anticipated, but in the most lovely of ways. And I think not only was it very personal, and that was very helpful to me. Like I really enjoyed getting to know how each of the three of you see, like I'm trying to see it through the lens that you're looking through. And I just felt myself like moving toward the camera, like wanting to see it the way that you see it. And I think that's the importance of these conversations. I mean, it goes to what Rosa said about empathy and what Jamie said about trust. And ultimately what Thelma said about the glass being half full. I mean, I think all of you showed that there are little things that we can do that will eventually change the big things. And to me, that's an important lesson that we can all walk away from and feel positive about. So thank you. It was an honor to be part of the conversation, honestly.
And I'd like to also thank all the panelists and also the participants for being part of a conversation. I think that everyone who's been engaged with both CIDCI and AMFP, sorry for the acronyms, for our organizations, ultimately what we care about is building a better world for everyone. And so that underlies all the work that we do. And it's been abundantly clear over the last 15 months that we all have a lot of work to do. Everyone does, to help rethink a paradigm that we thought we knew 2 years ago, which has been utterly upended. And we're in a bit of a period of uncertainty going forward. But like Dr. Hurd, I'm very optimistic about it. I think by raising these issues and bringing them forth, we will create a better world for everyone. And so I'd like to leave everyone everyone who's participating with us today with a sense of positivity about this. I think there's a lot of grief and pain that we've all come to understand and be a part of, but there are opportunities by raising this trauma up and working through it and creating a better world for everyone. So I'd like to thank everyone for sticking with it. These are hard questions, hard issues, but we will create a better world by addressing them.
Thank you so much.
Okay. I guess I get the last word. So I'd just like to thank again our amazing panel. It's been so wonderful to spend time with you in your living rooms or wherever you might be. We'll conclude our salon now. It'll be recorded and put on our website by Monday. So if you'd like to share it with other people, we encourage you to do that. Our next salon will be next Friday, or will be on Friday, July 23rd, featuring DPR's Henning Rodell on something completely different, which is a conversation called Preparing for Extraterrestrial Construction. That's about as different from today as we could possibly imagine. He's going to talk about what does it take to build on another planetary body, and does answering this question translate to benefits for us here on Earth? And we'll take a look at some of the theory and what's happening today from NASA and others about building in space. Special thanks to Monica Whistler for keeping us on track, and especially to AMFP for putting together this amazing group of people. Thank you so much. If you've got thoughts or questions, please feel free to reach out to us on the CIDCI website. Thank you so much, and good luck to all of you.